The first key factor is to understand whether the patient actually has the diagnosis that you think they do, right? So our genetic testing can be quite complicated to interpret, and so a lot of times people will have variants that are not quite clear, and they get that diagnosis even though it may not actually fit. So I think the first is to clearly establish that they have the diagnosis. I think second is that a number of the genetic conditions that I talked about have mechanisms of disease that exist in both overactive forms and underactive forms. So haploinsufficiency, loss of function, so to speak, and then also gain of function or overactive channels or receptors or whatever it may be. And that creates a very different landscape for the use of medications, right? You wouldn't want to give someone who has already a low functioning sodium channel additional medication to block that sodium channel further unless you really understood the mechanism at a precise level and that was indicated. So I think that is where the intersection of functional studies and, a really in detailed assessment and understanding of the mutation is necessary before selecting the agent. One final thought would also be dosing. So I think a lot of these kids, at least with some of the sodium channel blockers and sodium channel disorders, need super therapeutic doses sometimes to have the effect that we think they will. So I think it's important to review what literature there is to kind of get a handle on what to do in each situation.